Good afternoon, everyone. Today we will go for the anatomy of a pleura. Okay, anatomy of a pleura. Pleura it comes from the Greek word. In Greek, it is said it means of meaning of a pleura is side of the body or side of the ribs. Okay, and it is present just side to the ribs or side to the body. That's why it is said pleura. Okay, and definition of the pleura is it is a delicate serous membrane that lines each half of a thorax of mammals and is folded back over the surface of the lung of same side. Okay, you can see in last class or before we studied the anatomy of a lung, that lung how the peritoneum is covers the abdomen. Okay, and it protects the internal abdominal organs. That same way, okay, it lungs in lungs is protected by and it is covered by a delicate serous membrane. Okay, that it is very delicate and very thin layer is there that covers the lungs. Okay, that layer, serous membranous layer, is say as a pleura. Pleura it is a delicate serous membrane investing each lung. Okay, and folded back as a lining of the corresponding side of the thorax. Okay, can go for the next slide. You can see the how it is pleura is covers the lung, how the peritoneum is covers the abdomen. Okay, that same way that it is covered by the lung. Okay, you can see this is a lung. Okay, and this is a this is lung. Okay, this is a lung and this is a what you can say is a peritoneum. Okay, that what happened in this. Okay, this peritoneum. Okay, you can see in this picture. Okay, how this is a balloon. Okay, and this is our punch, and this balloon is filled with the air. Okay, and we punch it. Okay, and that time it is go the investigation or this punch is go inside. That same way the lungs also is covered by the one thin membranous layer. That layer is say as a peritoneum, and it also has the this punch. Okay, is covers the what is covered or okay finely attached layer is there, that is visceral layer, and with its outer surface or layer is there of a balloon, it is says parietal. And this lungs is held by the root, means there is the trachea. Okay, trachea, pulmonary artery, pulmonary vein, these are the roots. I will last class we discussed. Okay, the roots of a lung. Okay, that same way it is roots, and this is a covering is say as a peritoneum. In this picture you can see it is GF. It is not working. Okay, it is one video is there how the peritoneum is covers the lung. Okay, it is not working. Okay, that what happened, the lung is completely covered by the peritoneum, by the costal surface also, on the medial surface also, superior surface also, and inferior surface also. This is the costal surface, this is the triangular, it is a diaphragmic surface, this is the mediastinal surface, and this is the apex of a lung. Okay, you can go for the next slide. You can see like this. Okay, these are the roots. Okay, artery, vein. Okay, and this is a what cuff. Okay, pulmonary cuff, you can say pulmonary root is also covered by the peritoneum. Okay, the hilum of the pulmonary. You can say that, and this is what is covered, is completely covered by the what peritoneum, by the pleura. Okay, now we can go for the definition and layers of the pleura. Pleura, it is a serous membrane that covers the lung parenchyma and mediastinum and the diaphragm and the rib cage. Okay, it is not only covers the lungs. It covers the serous membrane that mainly covers the lung parenchyma, and it also attaches, and also it is covers the sides of the lung, that is the mediastinal side, diaphragm side of the lung, and the rib cage. Okay, inner surface of the rib cage. Okay, it comprises the visceral and parietal layer. Visceral means it is viscera. Viscera means organ which is attached to the visceral. Very innermost layer is says a visceral layer, and outermost layer is says a parietal. Per means outside, periphery. Okay, outside. Okay, we can, in this picture we can see that how the peritoneum is there, visceral layer and parietal layer. Okay, we can go for the next slide. The pleura is a thin, smooth, glistening, delicate serous membrane which covers the lung, lines the wall of the thorax. This is layer of the mesothelial cells and supported by the connective tissue. Okay, you can see here, this is a cross section of a thorax, and these are the lungs, and this is the gap. You can also see in the, when I told the anatomy of a testis, in that also I will explain the what is the meaning of the mediastinum. Here also mediastinum is came. There is mediastinum of the testis, and here is the mediastinum of the chest or the thorax. It is a gap between the two lungs. By that gap, vessels or hollow structures are moved, and this gap between the two lungs, it is say as a, in shortly, okay, not in shortly or in briefly, you can say mediastinum means it is a gap between the two lungs. By that gap, that is mainly some vessels or some hollow structures will pass out. Okay, and this is a cross section of a thorax. In that you can see that this is the laterally, this is the lung, and this is the mediastinum, and this is a root of a lung. By in this root, what are the structures will pass? Trachea, okay, or right bronchi, left bronchi, okay, and the vessels, pulmonary trunk or pulmonary vessels, artery, vein, like that, and lymph nodes also present here. Okay, they is passed into the lungs. Okay, and you can see this is a covering. Okay, this is a outer layer of the chest wall, okay, or thoracic wall. Okay, this is a parietal, outermost, this is a parietal layer, and this is a visceral layer. Okay, and it is a gap between parietal and visceral, it is say as a pleural cavity. Okay, this is filled with a pleural, little bit pleural fluid that makes the lubrication between the two layers. Okay, and this is the vertebrae. Okay, like that. You can see here in this picture clearly. Okay, what is the, how the pleura is arranged. Okay, this is the chest wall or thoracic wall or costal cage, rib cage. Just behind the rib cage there is a one thin membranous layer is there. That layer is say as a what, parietal layer or pleura. Okay, just below that there is a costal, okay, or ribs, lungs, that is thin membranes, not differentiated layer is there, that is a parietal pleura, visceral pleura. That visceral pleura also moved towards with these fissures also. Okay, you can see this is the rib cage, costal part, pleural cavity, this is cavity between the parietal pleura and visceral pleura, and this gap here you can see here, this gap or races is there, that is say as a costodiaphragmic races. Costo means costal cartilages or ribs, and diaphragm means here it is comes the diaphragm. This is a races or gap is present in between the costal and diaphragm. That's why it is a costodiaphragm. Another one is the, this is the diaphragm part of the pleura. Okay, and this is a mediastinal part of the pleura. Okay, this is a mediastinal part because it is present towards the mediastinum, and it also covers the some part of the mediastinum, or it is present just lateral to the mediastinum. That's why it is a mediastinal part, and this is the cervical or apex of the lung. It is just little bit comes the just above the clavicle. That's why it is say as a cervical part of the pleura or lung, and that apex of the lung is present on the root of the neck. Okay, that is cervical part is say as a that covered pleura is a cervical part of the pleura. And coastal part of the pleura means coastal means it is a ribs, it is present or coastal surface of the lung. Okay, that surface is covered pleura is say as a what coastal surface of a pleura. Okay, now we can go for the layers of a pleura. There is mainly two layers of a pleura. The two layers of the pleura, that is visceral and another one is parietal. The two layers that are continued by the pleura, one is visceral pleura and parietal pleura. The pleural cavity is a potential space between the viscera and parietal pleura. Okay, that is say as a pleural cavity. Now structures of the pleura. The each pleura can be divided into two parts. One is parietal pleura, another one is a visceral pleura. The parietal pleura covers the internal surface of a thoracic cavity. Okay, you can see here in this picture clearly. Okay, this is a thorax. Okay, these are the ribs. This is the outer surface and this is the inner surface. And parietal pleura is covers the what internal surface of a thoracic cavity. Okay, this one, and this is a visceral part. Okay, and visceral part it is covers the lung. The visceral pleura covers the outer surface of the lung and extend into the intralobular fissures. Okay, and it is continuous with the parietal pleura at the hilum of the each lung. This where structures enters and leaves the lung. Okay, hilum of the lung means where the structures enters and leaves the lung. Like that, this is the structures of a pleura. Okay, in this clearly you can see this is the internal surface of a thorax or thoracic cavity, and this is the parietal pleura. It is covers the or attached to the internal thoracic cavity, and visceral pleura. Okay, it is covers the mainly the lung and the features of a lungs, and this is a diaphragmatic surface or space or surface, and that covers the which parietal pleura, that is say the diaphragmatic pleura. This is which is covers the attached or have the connection with the internal thoracic cavity, that is say as a what coastal pleura, and it is attached to the towards the mediastinum, and it is present lateral to the mediastinum of the parietal pleura. That parietal pleura is a mediastinal pleura. Okay, and where the races, okay, or gaps is there or some space is there, that are the spaces is say the races of a pleura. You can go in the you can see in the next slides. Okay, then visceral pleura. Visceral pleura it would can't be separates from the lung. Okay, it is firmly covers the outer surface of the lung and extend into the its fissures. The two layers means mediastinal parietal pleura and visceral pleura are continuous with each other to form a tubular sheath or pleural cuff. Okay, that surrounds the root of the lung, and root of the lung contains vessels, nerves and bronchi in the hilum of the lung. Okay, this is say as a, this part is say as a cuff. Okay, root of the cuff or pleural cuff. Here what happened, this, okay, this is a pulmonary ligament. Here what is it, this what you can say as a, here both mediastinal pleura or parietal pleura and visceral pleura joins together or continuously forms a what one cuff like one tubular sheath. That sheath is say as a pleural cuff. Okay, that is say as a pleural cuff. On the lower surface of the root of the lung, the pleural cuff hangs down as the fold. Okay, and that fold is say as a pulmonary ligament. Okay, this is cuff. It is down forwards and joins together and forms the one what lower surface root of the lung, hang downs, that hanging down this one say as a pulmonary ligament. This is say as a pulmonary cough. Okay, that is tubular sheath around the hilum of the lung. Okay, here that is pleura is though both mediastinal and parietal pleura are continuous with each other to form a tubular sheath, the surrounding root of the lung. Okay, and to form the cuff, pleural cuff. The parietal pleura. Now we can go for the parietal pleura. The parietal pleura covers the internal surface of the thoracic cavity. It is thicker than the visceral pleura and can be subdivided according to part of the body that its contact with the surfaces. Okay, therefore parietal pleura is split into the following four parts. Costal pleura. Costa means it is attached to the ribs. Okay, internal part of the internal thoracic cavity. Okay, in that it is attached to the ribs or costal cartilage, that is say as a costal pleura. Diaphragmatic pleura, and which part of the pleura is attached to the diaphragm or in inferior surface. Okay, or triangular base of the lung. Okay, that part is as it is attached to the diaphragm, that part is as a diaphragmatic pleura. Or which lung is or pleura sit on the diaphragm, that surface is as a diaphragmatic pleura. Mediastinal pleura, which pleura is present lateral to the mediastinum, that pleura or part is as a mediastinal pleura. And cervical pleura. Okay, apex of the lung is present in the cervical region, and that covers the part or apex of the lung covered part of the pleura is as a cervical pleura. Okay, you can see here in this picture. Okay, this is a costal pleura. Okay, this is diaphragmatic, and this is a mediastinal, and this is a capsular or what you can say as a cervical pleura. Okay, yes one. The cervical pleura, it is part of the parietal pleura which protrudes up into the root of the neck. Costal pleura, it lines inner surface of the ribs, costal cartilages, inner costal muscles and back of the sternum. Okay, and diaphragmatic pleura, it covers the upper surface of the diaphragm, upper surface of the diaphragm. Mediastinal pleura, it covers the mediastinal surface of the. Okay, now the division of a parietal pleura. Parietal pleura is mainly divided as a costal pleura, scapular or cervical pleura, or mediastinal. It is present towards the mediastinal or mediastinal pleura and diaphragmatic pleura. Okay, first we can go for the cervical pleura. Cervical pleura is present at the apex of the lung. Okay, and it also has a relation with the fascias of a cervical or neck. Okay, cervical means these are the cervical bones, they are present in the neck, that's why the name came from the cervical. It is also say as a cervical pleura, as it is say as a capsular pleura, because it is how we putting a cap to the head, that same way this pleura is covers the head or apex of the lung. Okay, cervical pleura, it is a part of the parietal pleura which protrudes up into the root of the neck. Now costal pleura. Costal pleura, it lies inner surface of the ribs, costal cartilages, intercostal muscles and back of the sternum. Now diaphragmatic pleura, it covers upper surface of the diaphragm. And mediastinal pleura, it covers the mediastinal surface of the lung. Okay, like that, this is the mediastinum. Mediastinum, it is already told what is meant by in grossly. It is a gap between the two lungs. Okay, and that mainly vessels or any hollow structures pass from that gap. Okay, and it is looking towards covers the mediastinum, or it is present lateral side to the mediastinum. That's why it is say as a mediastinal pleura. Can go for the next slide. In that, see, it is a capsular, okay, or cervical pleura, and this is the costal pleura, okay, because it is present in the covers the coastal area, or it is present just below the coastal cartilages, or just below the thorax, or it is covers the laterally to the thorax. That's why it is as a coastal pleura, and it is situated on the diaphragm, okay, that's why it is as a diaphragmic pleura, and it is present towards the mediastinum. Okay, this is the heart, this is the heart, and this is present in the mediastinum, and it is lateral to the mediastinum. That's why it is as a mediastinal pleura, and this is a parietal pleura, and this is a visceral pleura. We can go for the next slide. Okay, you can see how it is. We easily understand what is meant by the mediastinal pleura, cervical pleura, coastal pleura, and diaphragm pleura. Diaphragmic pleura means this one. This one is base, okay, base of the trigone. Okay, it covers the thoracic, okay, or superior surface of the diaphragm. Okay, that's why it is a diaphragm. It is present or situated on the diaphragm, or it is superior to the diaphragm, or that's why it is a diaphragm. Coastal means covers the inner aspect of the ribs, coastal cartilages, and intercostal muscles. That's why it is a intercostal. Coastal means coastal, it mainly cartilages, okay, coastal cartilages. Coastal means mainly it is as a ribs, okay, cervical, apex of the lung, okay, and it is comes at the root of the neck. That's why it is as a cervical. It lines the extension of the pleural cavity into the neck. Then mediastinum, okay, it covers the lateral aspect of the mediastinum, that is the central compartment of the thoracic cavity, containing the number of organs. Like that you can see easily this one, okay, and what you can see, this is the first rib. Okay, now we can discuss the visceral pleura. Visceral pleura is the innermost layer of the pleura, or it is also said as a pulmonary pleura. It is firmly attached to the viscera, means organ of a lung. Okay, the visceral pleura entirely covers the top layer of the lung, with the exception of the hilum along the connection of the pulmonary ligament. I already told what is meant by the pulmonary ligament, okay, and what is meant by the how the pulmonary ligament is formed, and how the mediastinal pleura or parietal pleura, it is covers the root of the lung. Okay, it also extends into the depth of the fissures of the lung, and it is firmly adherent to the lung surface and can't be divided from it. Okay, coastal pleura, I already explained. It lies the inner surface of the thoracic wall, being composed of ribs, coastal cartilages, and intercostal spaces, to which it loosely connected by the thin layer of loose areolar tissue termed as a endothelial fascia. Its lines begins endothoracic fascia is easily separatable from the thoracic wall. Then relations of the coastal pleura. Anteriorly, what is relations? Mainly the coastal spaces and ribs, okay, and coastal ribs and intercostal muscles and sternum. Okay, these are present anteriorly. The inner thoracic vessels are directly located on the pleura within the first intercostal space, sternum, coastal cartilages, ribs, and intercostal muscle. And posteriorly, what is the relation? The coastal pleura is related to the sympathetic chain as well as its branches. The intercostal nerve is located in the middle of the coastal pleura as well as the posterior intercostal membrane at the posterior end of the intercostal space. You can see is how the coastal cartilage anteriorly what is the, you can see here it is comes the sternum. This is the coastal or ribs, intercostal, this is the intercostal cartilage, the coastal cartilage, these are the ribs, these are intercostal muscles, and like that this is our vessels. Okay, posteriorly mainly for the nerves. Now we can go for the diaphragmal pleura. Diaphragmal pleura means it is located on the diaphragm or inferior surface, that's why it is a diaphragmal pleura. The thoracic surface of the diaphragm is covered by the diaphragmal pleura. Below the lower border of the lung, the coastal and diaphragmatic pleura are in opposition to each other in quiet respiration. The margins of the base of the lung is declined and the coastal and diaphragmatic pleura split up into deep inspiration. On inspiration, this lower zone of the pleural cavity into which the lung enlarges is called as a costodiaphragmatic recess. Means it is a gap between the coastal means ribs and the diaphragm. That's why it is a costodiaphragmatic recess. Recess means it is a gap. Now we can study for the mediastinal pleura. It covers the mediastinum and the hilum is reflected to the vessels and bronchi that enter hilum of the lung. It continues with the visceral pleura. Okay, you can see here like this in this picture. This is a mediastinal pleura. This is a hilum of a lung or root of the lung, and this is a diaphragmatic pleura. It covers the upper surface of the diaphragm. Now, mediastinal pleura. Mediastinal pleura means it is covers and forms the lateral boundaries of the mediastinum. Subdivided into three parts. It is mainly mediastinal pleura. One is above the lung root and at the lung root and below the lung root. Okay. Then above the lung root, the parietal pleura forms the continuous anteroposterior sheath extending from the sternum of the vertebral column and is related to the number of structures which are different on two sides. Okay, on the right side, what is the difference between the mediastinal pleura in mediastinal pleura on right side and left side? Right side, what are the structures are there? It has the attachment, has the mediastinal pleura, right bronchocephalic vein, superior vena cava, arch of the gyrus vein, brachiocephalic trunk, right phrenic nerve, right vagus nerve, trachea and esophagus. On the left side, arch of the aorta, left common carotid artery, left subclavian artery, left brachiocephalic vein, superior intercostal vein, left phrenic nerve, left vagus nerve, recurrent laryngeal nerve, esophagus and thoracic duct. Now mediastinal pleura, it lines the corresponding outermost layer of the mediastinum. Already I have told it reacts lateral boundary. It is represented cuff over the root of the lung and becomes the constant with the visceral pleura. Okay, you can see this is a cuff to the root of the lung and this is a pulmonary ligament. Okay, here mediastinal pleura, parietal and visceral pleura both are covers this area and forms like that. Okay, the double layer of serous membranous sac of mediastinal pleura encloses the lung. Has two layers, parietal layer which lines the thoracic wall and visceral layer which covers the surface of the lung. The two layers continue with each other around the root of the lung where it forms the loose cuff hanging down. Okay, that is called as a pulmonary ligament. This is loose cuff hanging down. Okay, the space between the two layers is the pleural cavity and contains very thin film pleural fluid, that is 5 to 10 ml. Now we can go for the cervical pleura. It is the dome of parietal pleura which extend into the root of the neck above the 1 inch or 2.5 cm above the medial end of the clavicle, and it is 2 inches above the first costal cartilage. It is termed as a cupula and it covers the apex of the lung. It is covered by the suprapleural membrane. Contents of the cervical pleura. What are the? It is have the connections. Okay, connections of the cervical pleura. Anteriorly, subclavian artery and scalenus anterior muscle. Posteriorly, neck of the first. Another one disease of a pleura, that is a pleural effusion. Pleural effusion, it is a nothing but a collection of a fluid in the pleural cavity. Okay, it is maybe causes are different. Okay, it may be inflammation, it may be a pathological or pneumonia, or it may be tuberculosis. Any cause is there, or it may be by the hypoproteinemia. Okay, there is nothing but means pleural effusion means there is collection. Effusion means fill. Okay, filling is a collection of a fluid in the pleural cavity, that is a pleural effusion. In what happen in normal, this is a parietal pleura and this is a visceral pleura. The gap or cavity is a space is like that. There is in the pleurisy or pleuritis, there is what happen, the inflammation of the visceral pleura and parietal pleura also. The pleural space is completely thin. You can see here, this is a inflamed pleura, this is parietal and this is a visceral. This is a pleural space, it is completely become collapsed, okay, or reduced pleural space, okay, like that happened in the pleural effusion. In that, patient is suffer from the breathlessness. Okay, now it is a X-ray of a pleural effusion. And in that, what happened, I already told what is meant by the races. In the races, okay, there is collection of a fluid is happened. In races are acute in nature because the two parietal layers are completely opposite to the each other. Okay, two parietal layers are completely opposite to the each other. Because of that, what happened, there is a collection of fluid happen and that acute angle was destroyed. In this you can see this is a costophrenic angle. This is costal means this is a ribs and phrenic means costodiaphragmic angle. This is, you can see in this acute in this picture, but here there is a no acute picture or races you can see, and this is a costodiaphragmic space. Okay, this is also look acute, but in this case there is a loss. Okay, and this is obliterated costophrenic angle. Okay, this denotes the pleural effusion. Okay, in this picture you can see this is the lung and it is completely like this. This is a collection of a fluid or pleural effusion. This is, there is a obliterated costophrenic angle. Now you can say pneumothorax. Pneumothorax, I already have a collection of air in the pleural cavity. It is mainly spontaneous. There was a what happened, pulmonary emphysema or bulle, pulmonary bulles, or they are breaks and forms the collection of a what air in the pleural cavity, that causes a pneumothorax. Pneumo means air, thorax means thorax or chest, air in the chest. Okay, like that its meaning. Okay, that air in the pleura, that is as a pneumothorax. In that, lungs was collapsing. It is completely fluid, pleural cavity completely full with the air. Okay, and pneumothorax. In that, if it is air, it is pneumothorax. If it is pus, then it is as a emphyema. Emphyema means it is a collection of a pus in the pleural cavity. Okay, pleuritic chest pain, it mainly because of the inflammation of the pleura. It may be infection or inflammatory disease like rheumatoid arthritis, like that. Okay, and pulmonary emboli, there is also collection here. Okay, see, this is a tuberculosis of the pleurisy. Okay, like that, scattered. Okay, I can say asbestosis and mesothelioma. Okay, now pleural friction rub, when the fluid is reduced, that time parietal pleura and visceral pleura are rubs or friction, and that makes sound also you can heard in the these disease, pulmonary diseases. Okay, and patient also cause complains the pain. And these are the some diseases of the pleura, that is pleural effusion, pneumothorax. Hemothorax means collection of a blood in the pleural cavity, that is as a hemothorax. Emphyema means collection of a pus, and chylo, collection of a chyle in the pleural cavity, that is chylothorax. Okay, pleural thickening. Okay, pleural classification and tumors of a pleura and CA of a pleura. This is the some diseases of the pleura. Okay, thank you very much.